Hi, Dr. Anita Haque, your chiropractic coach and mentor. So let's talk about adjusting pregnant patients, especially the shoulder blades, the mid-back, the neck. We all know that we need to adjust their hips, their lower back. No question, especially when they're in their later trimester. But if you don't have the devices or a table specific for pregnancy adjustments, sometimes it can be kind of challenging to do some adjustments for the thoracic spine and even for the cervical spine. So I'm going to just show you a little trick, a little tip, something that I use as a small doc because it's not always easy to do the A to P move with the board. So here's another way to adjust their mid-back and make it easy on your pregnant patients. So I'm going to have you get onto the table on your hands and knees. And this is also something I do with patients post-pregnancy so that they don't have to have their chest hitting the table. Do you think that you can get onto your elbows? So I had her get onto her elbows because now her body's lower, and obviously you can tell how short I am, so I need her to be a little shorter too. So I want you to rest your head down. And this is kind of like having a Gonstead seated table sort of feel. She's in the suspension mode. Obviously I don't want to keep her here too long to make her shoulders get tired, but it is a good little exercise for your shoulders. And you're just going to breathe in and breathe out. Let it go. So we already got a great adjustment right in between the shoulder blades. And you can actually just go up and down the spine with the palm of your hands, or you can do like the knife edge and get in there. If you feel like you're not getting enough in between the shoulder blades because the shoulder blades are there, just go ahead and relax this arm a little bit more. There you go. And we can get in a little bit better. Okay, you're all set. Come on down over onto your back. And then of course, you can do the rest of the adjustments with the cervicals, either seated or laying down supine to make it more comfortable for your patient. So don't be afraid to get in there and attack those subluxations, especially through that thoracic spine, because they need it more than ever. And because she feels so much tightness in there, be sure to check their shoulders. Go the extra mile. We know how everything connects to everything else, right? So getting her shoulders, her elbows, and wrists, especially in their third trimester when things are inflamed, there's more issues of carpal tunnel. So even if your patient doesn't ask you to do this, I recommend what's going to separate you from the other docs. And it's not a matter of a competition, but what makes you the best is that you're thinking for the patient. You're thinking, if I was in her shoes, what would I want to have done? Okay, so practice these adjustments, and I'll be back again soon with another tip. Keep your questions coming.